Hello everyone, this is the third video in the introductory series. We've covered red cells and white cells in previous videos, the links of which you can find in the description below. This video will be looking at platelets. Before we start, here's a quick question for you. Do you consider platelets to be cells? Leave your comments below. We'll discuss this and the morphology of platelets in this video. Platelets, or thrombocytes as they are also known, are fragments of a cell and so not really cells themselves. On the right hand side you can see an image of a megakaryocyte. Platelets are pieces of the megakaryocyte and contain a bit of the membrane and also some cytoplasm. When it comes to size, normal platelets are the smallest in comparison to red cells and white cells. A normal platelet is about 1.5 to 3 micrometers in diameter. If you remember, a red cell is approximately 7 to 8 micrometers and white cells can be as large as 15 micrometers in diameter. In certain conditions, the size of the platelets may increase, for example in myelodysplastic syndrome or May-Heglin anomaly. Platelets can sometimes be as large or larger than the red cells. The latter is known as giant platelets. As platelets are fragments of the megakaryocyte, they do not have a nucleus of their own. They inherit their membrane and most of their contents from the megakaryocyte itself. Platelets are biconvex in shape and are surrounded by a plasma membrane. The platelet membrane is covered by a glycoprotein coat containing receptors without which they wouldn't be able to do their functions. Examples of receptors include GP1B, GP2B3A. The phospholipids in the membrane are able to produce the pro-inflammatory arachidonic acid. Lastly, the membrane is able to release calcium, which is necessary for contraction and release. The cytoplasm provides strength to the platelet. It contains a range of different things. Actinomycin are present for contraction and release. There are residual Golgi and rough endoplasmic reticulum for enzyme synthesis. Not much of this can happen without energy, and so the powerhouse of the cells, the mighty mitochondria, are also present. As the platelets will be involved in the formation of a clot, they have fibrin stabilizing factor. This is also known as factor 13. But once the thrombus is over, they're like good pets who clean up after themselves, and so also contain platelet-derived growth factor, which helps in the repair of the blood vessel. Finally, platelets contain granules, the alpha granules and the dense granules. Let's talk a little bit more about those and what they have within them. The table below shows a comparison between alpha granules and dense granules. Alpha granules are protein in nature. They contain factor 13, which is also known as fibrin stabilizing factor. There is platelet activating factor and platelet-derived growth factor, which aids in regeneration and repair. Von Willebrand factor is also present. Fibrinogen, which is a coagulation factor produced by the liver, is stored within the platelets. Lastly, platelet factor 4 is also present, which is implicated in heparin-induced thrombocytopenia. Next, we have the dense granules. These are not protein in nature and contain ADP and calcium ions. The calcium ions are integral for contractions and also act as binding agents for vitamin K dependent coagulation factors. Okay, finally, I've got a few blood film images of changes that we can sometimes see in platelets on the blood film. This first image is from a patient with May-Heglin anomaly. The platelets are quite large in size, much larger than we would expect normal sized platelets to be. You'll also notice their grey dolly body inclusion within the neutrophil on the right hand side. Okay, moving on. This second image shows platelet clumping. Platelet clumping is an in vitro phenomenon in which, as the name suggests, the platelets clump together. Clumps can vary in size, some containing a handful of platelets and others can be very large like the one that you see. On the automated analyzer, this would give a pseudothrombocytopenia or a falsely low platelet count. In this final image, the arrows point towards platelets, but you notice straight away that these platelets look different from the others that we've seen. Normal platelets stain with the purple granules, however there is none in here. This is grey platelet syndrome, also known as platelet alpha granule deficiency. We'll touch on all of these conditions in a later video when we go into more detail about platelets. Thank you for watching the video. If you found it enjoyable and informative, please do give a thumbs up, and if you loved it, hit the subscribe button below.